Hi everyone! Welcome back to my channel and welcome to all new viewers. My name is Olka and I'm a UK-based vet, and in this week's video I'm joined by 3 registered veterinary nurses who will talk about their profession. What made me want to make a video like this was a feeling that general population has a pretty decent idea on what a vet does, but the role of a veterinary nurse often confuses them. Here in England, veterinary nurses serve a very important role in the busy everyday life of a veterinary practice, and I thought it would be really interesting to hear what they have to say. Before I get to it, please don't forget to like, subscribe and ring that bell if you enjoy my content. This allows me to keep this channel going. I aim to release a video every week. I also have an Instagram account where I post daily, so go and check it out. Without further delay, let's dive into the topic of this week's video.
Hi, my name's Kaylee Bartle. I'm a registered veterinary nurse and I've been registered for nearly 2 years now. So as a veterinary nurse we have loads of responsibilities, main ones being anaesthetist, nursing sick patients, giving medication, prep nursing, so preparing the animals for their surgeries, radiography, we take a lot of x-rays, we do a lot of lab work, so running bloods, urine samples, looking under the microscope. We also do a lot of animal restraint for the vets, for taking, for when they take blood samples or they need to check the pet over and the pet's being a little bit wriggly. We're the ones that, hold them and make sure that they're secure. We can take blood samples, put in IV catheters. We also answer a lot of phone calls, answering client questions, booking appointments, giving lots of advice. We're also a triage nurse, so if an emergency comes in, we'll go and triage the patient, have a look at them, make sure they're not dying, and we'll take them out the back and we can sort of start emergency medications and things. Obviously, boring thing, we do a lot of cleaning, but unfortunately cleaning is something that needs to be done. It helps keep the practice nice and clean and sterile, ready for the surgery so the animals don't get infections or anything. We make sure they have nice clean kennels and beds to go into, so it's less stressful, so they can't smell other animals have been there. So we do a lot more than that, but that's just a lot of daily responsibilities that we do most of the time. So we're a very busy practice, so we do most of them.
Hi, my name's Vic Burkett. I am a registered veterinary nurse. I have been nursing for 21 years and I've been qualified for 16. I work in small animal practice, but I have also worked doing out of hours, working alongside soft tissue and orthopaedic referral, as well as emergency CC. At the moment, because of COVID, it can be crazy. We are all assigned to our own vets each week, so we're kind of working in bubbles so that we're not contaminating a whole team, just in case someone comes down with COVID. So a day can look like spending all day in a consult room, holding every single animal that comes into the practice, assisting the surgeon while they perform examinations, empty anal glands, perform blood samples, or the vet surgeon will help me if I have the occasional post-op check or laser therapy to do. Or we can be in theatre doing our daily list of non-essential surgery, really, so that could be dentals that need to be done, routine procedures like spays or castrations if there is a risk of pregnancy, x-rays, ultrasound, or I could be not assigned to a vet and then end up being in kennels monitoring patients as they recover from surgery, monitoring patients as they've had pre-meds, discharging patients when the vets are ready to send things home, arranging for things to go home. Pre-COVID times, I would have been the consultation nurse. That's my thing. I love clients, I love patients, I love education. So normally I would be in the thick of doing nurse appointments, which could include puppy and kitten chats, microchipping, laser therapy, which is a big thing of mine. We could be doing blood pressure monitoring, blood sampling. After that I would be out the back dealing with the drug order, putting that away, assigning the drugs to any clients that need them, assigning food to them. If the vets needed a hand to do anaesthetics, any procedures, I would be there available to help them, and then again going into kennels, taking over from the nurses at lunchtime to recover patients, to arrange discharges home. Processing lab samples, whether that's running bloods internally or processing samples to go to the lab, making sure that we put the samples out for the lab. Very important task that I often wake up in the night in an absolute panic thinking, oh my gosh, have I done this? And it is, I always have, well, usually will have done, but it's always one of those, did I remember? Assisting reception, answering the phones, assisting the vets if they need blood samples or anything like that requiring for the patients that they do have in, or if they do need a hand.
Hi guys, my name's Gabby and I am a registered veterinary nurse in the northeast of England, and I have been qualified for 12 years now. So I think this is always a really difficult question to answer, but it really boils down to the fact that I love animals, and I always have done. I think my passion for animals comes from being a small child. I grew up with them and I've been fascinated by their lives and their habits, and I knew that I wanted to study and be around them as much as possible. I had a rabbit and a guinea pig when I was growing up, and various family members had dogs that I loved to be around, and I used to help ride my friends' horses, and my grandma and granddad used to own a farm, so a lot of my time as a child was spent at the farm helping with the animals and doing stable work, so I'm not afraid of a bit of hard work. And I started volunteering at my local vet practice when I was 12, and I was pretty hooked from then, and I knew that this was the career that I wanted to pursue. So as I grew up, it was important for me to learn how to look after my animals properly, and it's become a passion of mine to pass on this information and to educate owners to ensure that your pets get the best care. So it's important to me to be the best advocate that I can for my patients and their owners. I consider that I have a very privileged position to be able not only to protect the health and welfare of the animals that I work with, but also the general public. I have a duty to provide education around things like vaccinations and worming schedules for your animals, to not only keep them disease free but to prevent disease transmission in humans too. And I've always loved learning, so to be in a job where no 2 days are the same and I get to learn something new every day still amazes me.
From a young child, really, I've always absolutely loved animals and have a big passion for animals, and I just love being able to be there for them and care for them, and I just love animals.
I don't know, I was doing a animal care course and ended up having to do 10 weeks in animal practice, whether that was in kennels or vet practice or anywhere working with animals, and I ended up spending a lot of time weirdly in the practice that I currently work in, and just got offered a job, so I took it because I didn't know what else to do and I did enjoy it. So worked my way up, got qualified, and 21 years later I'm still nursing.
So after I finished college to get my A-levels, I decided that I was going to go to university to get my veterinary nursing foundation degree. So there's several ways of obtaining the veterinary nursing qualification. There is the foundation degree route, the full degree route, the diploma, or the apprenticeship route. So I had to complete 1 year at university, and then a 6-week placement in a Royal College of Veterinary Surgeons accredited practice between my first and second years at university. After the second year, I then had to complete a full year's placement in practice. So overall I had to carry out 1,800 hours of physical placement to gain my qualification. So whilst I was in practice, I did a nursing portfolio to show that I was competent at a range of tasks. And during my time at university, I studied modules such as anatomy and physiology, reproductive physiology, farm animal management, equine therapy, microbiology, statistics, anaesthesia, emergency care, exotic animal management, radiology, pharmacology and analgesia. And it would take a further year to obtain the full Bachelor of Science degree in veterinary nursing. So to be entered onto the register of veterinary nurses, I had to complete my nursing examinations, which involved a theoretical part and a physical task part. But the learning doesn't stop when you qualify. So in order to remain on the register of veterinary nurses, we have to pay a yearly registration fee. And we have to complete 15 hours of continuing professional development per year, although most nurses will complete many more hours than this. So there are also many opportunities to advance your qualifications in various subjects once you've qualified. So I completed my advanced anaesthesia and analgesia certificate, but there are qualifications in dentistry, physiotherapy, surgical nursing and emergency and critical care. So overall it took me 3 years, but there is the option to complete the full degree course, which would take 4 years.
So it took me 3 years at college to become a registered veterinary nurse. So I work, as a student veterinary nurse, I would work over 30 hours every week in practice, and I would also go to college 2 days a week. So I'd go to college Monday, Tuesday, and then I'd work for 30 hours Wednesday, Thursday, Friday, so about 10 hours each day. So, and also while we're working, we also have to do our nursing progress log, which is, as a student, you know, everybody hates this as a student. You have on the computer, you have to log loads of different tasks you do, and you have to get your clinical coach, which is someone that trains you, to make sure you're competent and confident with all these different tasks. So that takes at least a year and a half at minimum to complete that, because there's just so much work that needs to go into it. And also on top of that, we've got assignments that you need to write, and also you've got to study for your exams, so you have to find the time in between working, going to college, to be able to study for your exams as well. So it's quite a lot of work crammed into sort of the 2-3 year course that you've got to do, but it's definitely worth it in the end.
It took me 2 years of going to college and then going away, sitting theory exams, and in the final year doing practical exams as well. I did also need to complete a portfolio log, which at the time was all paper based. That actually took me a year longer than it should have done, so it actually took me 3 years to qualify rather than 2. Probably because I was quite kind of lazy, but also didn't probably want to qualify, maybe because I was a bit scared of kind of what would happen, and the responsibility that comes with that.
So veterinary surgeons obviously have a lot more responsibility than a veterinary nurse, and they're the ones that have to diagnose the patients, they have to do the operations, and prescribe medication to the animals and the inpatients and things. So their job, they've got so much that they need to do, massive responsibility. A veterinary nurse, obviously we can't diagnose anything, we're not allowed to prescribe any medications. However, as a veterinary nurse, we are allowed to operate as long as we don't enter a body cavity, which So we can do basic surgery, like stitch up wounds, and we can also remove lumps as well, which is pretty cool. But a lot of nurses like to do an extra certificate in that, just so they have the extra knowledge behind that, because that's not something we do on a daily basis.
Well, the veterinary surgeon prescribes the care and the veterinary nurse gives the care. Two totally, utterly different roles. You probably wouldn't find very many vets that can actually nurse, and sometimes things like anaesthetic monitoring, you find, you know, some vets are amazing at it, but a lot of vets actually get really scared of it. They can tell you, you know, you give them numbers and say this is happening, what shall I do? And they will tell you all sorts of weird, wonderful things to do, but you actually get them to monitor and listen to a heart rate and listen to a respiratory rate and monitor, and they panic. It's really weird. You know, these amazing human beings, and they can tell you just from looking at machines and numbers and things what to do, but you actually get them to do something that nurses do every day, and they don't like it. Restraining things as well, sometimes vets really aren't good at, because it's not something that they do. The nurses take the time with the patients. Usually vets will come along, tell us what's wrong or what they feel is wrong, give us a list of things to do. We will do those things, but we will also care for take the time to care for the patients, whether that's giving them medication, TPR in them, taking them out for comfort breaks, actually getting to know them, getting to know their little ways. Vets don't actually have a lot of time to do things like that, so usually it's us kind of compiling all of this information together and then giving it back to the vet for the vet to to make plans and decide from.
So this one, again, there's so many aspects to my job that I love, but I think being able to nurse a patient back to full health is always going to be up there with the top ones. There's no better feeling than being able to provide care and love to an ill patient as if they were your own pet, and seeing them turn a corner and start to get better. And knowing that you've been involved in that process is what gives me huge job satisfaction. I love utilising my knowledge and my skills, and being respected enough by my vet team, who value my opinion on my patients and how they're doing. I'm the one that's nursing your pets closely, and I'm picking up things like when they're in pain or they're feeling sick, and I can relay this back to the vet, and we can alter their treatment plan as necessary. Or if I have an animal that's not eaten for days, it fills me with such pride being able to finally persuade them to eat on their own. And it might have taken me umpteen trips to the local supermarket to buy only the best tuna flakes or chicken breasts, but to see them take that first bite after so long is such a good feeling.
So I love lots of things about my job, but most importantly, I like it when we get a patient in that's been with us for a long time, and we've nursed that patient and the patient recovers from whatever they were in for, their illness, and they go home healthy and happy. That's very, very rewarding. It just makes you realise like why you do the job.
The people that I work with some absolutely amazing, and have worked with some amazing people. I think we're probably a breed of our own. I think you have to be to do the job that we do, because obviously we do work with, we work with sad cases as well as like seeing puppies and kittens and things. We do have our own, we probably live in the gutter quite a lot of the time. We do have our own laughs. Maybe, I wonder anyone else outside listening to some of the conversations that we have, they would think that we were crazy. I love laser therapy. I love the fact that I am responsible for what I do, and I am proud of what I do, and the team, and what the team of nurses do. I do like clients as well. Like I say, I'm a rare breed. I do like nurse consults. It's very rare you find a nurse that's actually keen to do that. But I do like the clients, and I miss that at the moment, not actually getting to spend a lot of time with clients. And at the moment, because we are in lockdown, the patients I get to fall in love every single day with patients that come through the door, and sometimes we get to learn their own little tricks and, you know, get them to down and stay and do all the random little things while we're waiting for the vets to do examinations.
A big one is obviously when we have to euthanize an animal. It is heartbreaking to put an animal to sleep, it's upsetting every time, but we see it as it's the last kind of thing we could do for that animal. So if the animal's suffering or in pain, you know, we can give them that, you know, that nice passing, you know, peaceful, no pain, they just quick, you know, and we can give them that rather than them suffering for any longer. So although it's sad, you know, it is something like nice that we can do. Also, another thing I don't like about my job is the complaints we sometimes get from the public saying that, you know, we're in this job for the money, which we're really not, especially not nurses. We don't get paid enough to be in it for the money, unfortunately. We do it because we care about the animals and we just want what's best for them. We don't want them to suffer.
Anaesthesia, it's one of those things that you have to put lots of things together, and you can never say, right, this is going to be like this. Every anaesthetic's different, and I just don't enjoy that side. Don't like the surgical stuff so much. Also, the way we do euthanasias at the moment, I am quite a huggy person, quite a tactile person, so I find it really hard not being able to comfort people.
Yes, it is physically and mentally exhausting, but it is worth it at the end. So it's, yeah, we do a lot of long hours. You know, most of us where I work, we do 40 plus hours a week. We usually miss a lot of our breaks. We don't go for lunch at like late times because there's other responsibilities that we have to take care of, like looking after the animals. That always comes first, and we usually end up staying back sometimes hours and hours, or coming in our days off to help out because it's just always quite busy, but it's just one thing that's part of the job. So because of that, it does make it quite a hard job. And obviously us as veterinary nurses do have a lot of responsibility as well, and we're responsible for our own actions and things, so we still do have quite a lot of pressure on us to make sure that we're doing everything right.
Yes, especially at the moment, because at the moment we're not maybe fulfilling, or I feel like I'm not fulfilling the role that I was, and the role that I like to play within the practice. It is hard work. I'm getting old, so hanging on to animals every day, all day long, can be really hard work. Like only last week I've hurt my shoulder having to hold on to big, you know, a big Rottweiler that decided it wanted to try and pull me across consult room. Normally a client would have hold of their own dog and would have their own dog under control. In normal times you love it. If you didn't love the job, you wouldn't do it. So I think because you love it, it's not hard. Obviously there are things about the job that are hard, like euthanasia. We deal with complaints, you know, unhappy clients. That does make it hard, and even unhappy staff sometimes.
This is a really tough one. There are so many, but I think veterinary nursing is becoming more and more recognised as a profession. So I've definitely noticed a change with the frequency that I get to hear these now. I'll give you an example of a couple of big ones that I often hear. You must want to be a vet, or you're just a trainee vet. Absolutely not. Veterinary nursing is a profession in its own right, and just as is being a veterinary surgeon. We train long and hard to earn our title as a veterinary nurse, and it's something that we're very proud to be called. And another one is all we do is stroke puppies and kittens all day, and oh how I wish this was true. And although we do get our fair share of beautiful puppies and kittens to cuddle, there's so much more to our jobs.
People think that we just pat dogs all day and kittens and play with cute puppies and things. We don't at all. It's amazing the arsenal of skills that we have that people just aren't aware of. Not to mention the knowledge that we have over various different species, not just cat, dog, you know, not just like a human nurse. And people think that we want to be mini vets, which I think I've only ever known one nurse in all of the nurses that I've come across that's wanted to be a vet. And that's quite insulting really, because we, like I say, we have a totally different role compared to a vet.
Yes, massively. So the job is heartbreaking at times. Like I say, like when a patient passes away in hospital, it's really heartbreaking, especially for those nurses that have formed a bond with that patient and have got close and been looking after that patient. Or euthanasia of healthy animals, that always really, personally really affects me. It upsets me, and a lot of the time, you know, we go home and we just, you know, cry, because it does really affect your mental health.
Yes. Weirdly enough, bear in mind I've been nursing 21 years, I didn't realise this until I was watching a mental health CPD the other day, that they were saying about not only identifying yourself as a veterinary nurse, and that's something that I have done that I didn't even realise I did, which is probably why I find COVID so hard, because previous to, like, I have a 3-year-old child, almost 3-year-old child, so previous to having him, I was free to do what I wanted. So I would always pick up the night shifts, I would do the weekends, I would do whatever needed to be done, because I was a team player and I loved my job. And I think that's why I found maternity so hard, because I did lose my identity. Weirdly enough, I was just talking to a doctor just the other week about my mental health, and I remember saying to him weirdly before I watched the CPD that I felt like I'd lost a bit of myself, because I wasn't doing the job that I do, because I'm not seeing my own clients. I do suffer from imposter syndrome as a veterinary nurse and as a mother, so I do find it quite difficult to get away from that. Like, it's amazing how I look back on my career and be like 21 years of nursing, working alongside referral service, monitoring amazing amounts of patients whilst assisting, you know, doing endoscopes at 3 o'clock in the morning. Yeah, and how I can look back and be like, oh my god, I can't actually believe I did that. And like coaching students and things, I think I just feel like I bluff my way through it, and I totally do feel like that as another too. I just totally wing life, totally winging it, and I don't have a lot of confidence in myself, which I'm trying to build. I was told by a counsellor years ago that I shouldn't do the job, I should maybe move to something else, but I don't know what else I would do. But also that I do have high expectation of myself and not so much of others, which is why I struggle so much. But I think if you look at vet nurses across the board, we're all the same. We have extremely high expectation of ourselves, because we're in the profession that we do, and we care passionately about what we do. It is a hard one, not to mention, you know, we work with vets who are second highest in the country to commit suicide. We do need to very much be aware of mental health, which I think years ago when I first started nursing wasn't something that we were maybe so much aware of. It certainly wasn't kind of taught and talked about, I suppose, because the internet wasn't really a big thing either, because we just do the job, and we deal with euthanasia every day, which is, you know, and death and things, which is quite sad really. But you just do it, you don't think about it. But sometimes you do get to the point where you burn out, because you're trying to do all of this stuff and trying to deal with you know, a lot of emotion and emotional people, with clients and members of staff as well, that sometimes it does just knock you flat, and you do need to kind of take time to pick yourself up a bit.
And it's me again. Massive thank you to Gabby, Vic and Kaylee for taking part in this video. It was great to have you present your perspective. I hope this discussion helped you understand better who a veterinary nurse is and what role they serve in taking care of your pet in a veterinary practice. Or maybe you are someone who is considering training towards becoming a veterinary nurse. I certainly hope we helped you in your decision-making process. And lastly, thank you for watching. I hope you liked my video, like, subscribe, and I hope I'll see you here again soon. Bye!